Now, I want you to listen to the part where Health Cabinet Secretary Aden Duale is being grilled by Citizen TV's YVONNE Okwara on the question of exactly why are we sharing our health data with the United States in this 5-year-long healthcare program equatable to 850 million US dollars. His responses will blow your mind. I want you to just pay close attention as we listen to this bit by bit, and then I'm going to give you my word on it.
Group.
Still,
Yes.
the question is, per this agreement, because they're giving over 200 billion.
Let me ask you. Let me even take it another way.
Kenyans want to understand this. Let's just understand. For what purpose is the US going to use the data that the Kenya government is sharing?
For what purpose? What purpose were they using before?
Tell me, Waziri.
No, I'm telling you that USAID, which was heavily funded.
Which you have said,
no, let me ask you.
Which USAID you have said you are discounting the work that they've done. You've said they were not using the data. This is an agreement, Waziri, that the Kenya government
I didn't
has
say they're
signed.
not using the data.
Well, but you said you didn't have control or oversight over
Yes.
it, right? Now you have control or oversight over the data, yes, for this agreement?
Yes.
And as part of control and oversight for that data, you would know what the U.S. government is
Okay, let
going
me
to
give
do
you an
with this
example
data.
why we share.
It's a simple question, Waziri. What are they going to do with the data?
Let me give you the reason why we want to share with the data with the U.S., particularly in this framework. Okay? We have become partners. Okay? They are our co-investors. We plan with their resources. We monitor, we evaluate. Okay? Invested in HIV, for example, through NASCOP. HIV, TB, malaria, we will invest them through NASCOP, particularly HIV and TB. Now, for us and them to know the investment we've made in this sector of our health, what are the indicators? What are the data? These are basic data. What are the indicators? We are buying commodities. We are scaling our laboratories. We are dealing with surveillance and epidemics in our region, in our country, through the Kenya National Public Health Institute. Those institutions, basically, NASCOP deals with scientific data. And that scientific data is a data that we share with the people of Kenya, that we share with our partners, that we share with global institutions like WHO, like UNAIDS. That is how data is shared. But that's why I told you, the fear that Kenyans have is, do we share?
Of course, of course, there's an individual
that has been insulated in this agreement.
The other fear is basically because data is big business and data is important. So we can talk about data is important. Is it not?
Of course, data is important.
Good. All right.
So you use data to plan.
Okay. So they will be using our data to plan for what exactly? Considering the data sharing agreement outlasts this cooperation framework of 5 years. So they're getting access to our data for 7 years, correct?
Yvonne, let me make it very clear. I think we are missing the point. We have invested 200, in our agreement, we've invested 210 billion, or 1.6 billion US dollars. Okay? We're not investing in a bank. We're investing in the health system of the Republic of Kenya. These resources we're investing, and this human capital we're investing, in this security commodity we're investing, and in the disease surveillance we are investing, and upscaling of our laboratories, we must get data to show where we are. What is evaluation and monitoring? If you buy commodities, for example, for the people who are on ARVs, for you to plan logistically, you must have the data. So at the end of the 5 years, and the Kenya government is transiting and taking over at this sustainable healthcare, the whole thing we're doing in the ecosystem, the baseline is data. I will give you a good example. We have 27.8 million Kenyans who register. We can aggregate them into gender, into county.
Let me tell you something. This deal is a sham. It's a sham in a sense that if it doesn't give clear outlines on how and some of the, let's say, some of the guidelines, some of the, let's even say legal guidelines that are going to actually give a panoramic leeway and how, on how this partnership is going to operate for those, for that half a decade, we are screwed. Because some of the reasons he's giving is that he says, of course, if you have to partner with that country, you have to give them your data. Bruh, where in the constitution does it say that if a superpower country, of course it is, if it's giving you a grant to support a healthcare program, then you're entitled to giving them your data? That already shows that they're using you as a guinea pig. And I'll give you a perspective of a professional eye on it. Right now, in the tech space, for this, let's say, these major countries that are on the leading front line in developing LLMs, there's something called data renting. This is where, for example, a big tech pays or collaborates maybe with white hackers, professional white hackers or black hackers. They pay them a huge amount of money, of course, with the leading one who's an expert. They buy data from maybe an institution, a country, a government, and they use that data as a prototype to develop one of their LLMs. And this is what I'm seeing right over here. Data renting. That's what it's called. Another one is data mining, where just for example, if you're operating, it could be a financial institution, it could be a government, could even be an individual. Famous, not famous, but so long as you're out there and you have your details and you're running something that's of public interest or is serving people, you are prone to infiltration by either black or white hackers. So if a country like the United States is paying Kenya with 850 million US dollars to exchange healthcare data, then it should worry you and give you sleepless night, because on that data renting and data mining, you are screwed. You are screwed. And that's going to literally be the order of the day for 2026, 2027, all these big techs. And look at how many LLMs are headquartered or centered in the United States. From the GPTs to the NVIDIAs to the rest that have developed all these, these LLMs that you guys are using. So that should tell you something. And even with the vaccines and what Bill Gates is doing, so many questionable and just unlinked, unexplainable, dealings that definitely should raise the public concern. I don't know what you make of this. I find it to be really ridiculous, bizarre, and still tacky. But yeah, we can't wait to see how it's going to pan out.